Another thing I like to talk about is our mid-thoracic area, right? So a lot of times we talk about our neck, getting it to where it needs to be. We're going to talk about stretching out the shoulders here in a second, but mid-thoracic is super important because as our head comes forward, you naturally round in this mid-back, right? That can become fixated, adhered with a bunch of gunk and adhesions in there, which a lot of people find basically feels like it's just pulling them into this chronic state of tension. If you can't break that up and get healthy movement or fluid going through those joints, it just becomes a compounding problem over time, okay? So the idea with this is to get things free and flowing, and that's actually gonna help open up the rib cage, the lung capacity can actually expand, and you should feel like it's actually easier to breathe deeper and less strain. So in order to do that, you're gonna basically just take a foam roller like this, come through here, assess yourself at the very top. So you wanna start out higher, and then you wanna basically arch around and then come through. You come up to about midway here. Again, you want to arch around, let your whole body open up, and then come through. So we're going to do a total of 3 times, going lower each time, and then open up and through. And you're going to do that twice over. So basically, you're going to hit it 1, 2, 3, and then reset, and 1, 2, 3. Another thing I would like to demonstrate is the doorway pec stretch. The doorway pec stretch is a lot like a chest stretch on the foam roller, but you use the doorway. A lot of patients do this incorrectly from what I've seen in previous clinical experience. What you don't want to do is just lean into the door on both sides. That strains the shoulder. What you want to do is get a nice pure lineup, same leg as the same arm through the doorway. I'm going to repeat this on both sides. So you're going to come in 90 degrees, step in with the same leg, same arm, 90-degree football goal, and then open and away. And then what you can do is you can bring it up to about 45 degrees, and you're going to do the same concept looking away and hold for 20 to 30 seconds. What it does is it allows you to hit the different fibers in your pec muscle. What you have is a composite muscle, which means that it's made up of 2 different things, right? It's made up of the fibers running this degree and this degree. So hitting it at different levels gives you different stretches. So when you open this up in the front, you naturally allow your shoulders to fall back. And then in turn, what I want you to start doing is a shoulder blade squeeze. And you can do this up against the doorway, but shoulders are down and back. Shoulders are aimed at your back pockets like you're trying to tuck them in. And then what you want to do is, again, just a small chin tuck that we talked about earlier. And then you want to just squeeze, squeeze, squeeze. And you should feel like you can hold a golf ball between your shoulder blades if you're really getting good contraction. It's not about moving your arms back and forth. All you're doing is working your arms if you do that, and that's not the point of this exercise. So you want shoulders down and back, slight chin tuck, and then bring those shoulders down. Don't use those upper traps because that's the stress muscle where we're always holding tension anyway. You want to train these lower muscles back here to be operating and firing more appropriately. Along with these ergonomic corrections, standing and sitting at times, if you're having low back pain or having neck pain, take a moment to get that computer eye level, right? You don't want your computer screen lower or even slightly below eye level. You want it to be eye level or even a little higher because we're looking down all day long. We're looking at our cell phones. We're looking down at paperwork. So whenever we can, we want to get your screen eye level or higher.